1st August to 7th August every year is celebrated as Breastfeeding Week. So, as a part of this program, we are also celebrating this issue, very important issue, that is successful and exclusive breastfeeding for the first 6 months. Before going into further details, Sri Somnath from Nestle will tell something introductory for the program.
Good afternoon to all. My name is Somnath from Nestle. Today we are having a seminar over breastfeeding. So we are having 3 types of presentation over breastfeeding. One is regarding the normal breastfeeding. Second will be the overcoming the barriers for breastfeeding. And the third will be the feeding of the infants. Basically, our motive is to create a healthier generation through a healthier breastfeeding. So, if we start healthy, so we will generally become a healthier society. Because presently, if you see in India, the breastfeeding all over India is going to be 54% in the first 6 months of life. So, to achieve this breastfeeding in a much more prominent way, so from Nestle, as we are an infant milk formula company, we also believe that breastfeeding is the best, and every mother able to do so will be the right, will give the right nutrients, and there will be no need for any other alternatives. We are there only in the case of some alternatives. So we want to do a successful breastfeeding in a proper way. So today we are having some seminar. Maybe it is quite an easy or a normal topic, but today we will be highlighting some of the major barriers, and maybe the techniques what we do in a day-to-day life may be the similar or easy. However, there are some mistakes, and we should learn how to, in our discussions, so we are having in our presentations, how we can overcome this thing so that the breastfeeding can be in a better way. So we are having all these type of presentations in a detailed way, and hopefully you all will like the program in a, very much, as because we are prepared from a very large time. And as because from Nestle we also believe that breastfeeding is the best. So to ensure how the breastfeeding care should be taken, so today we are having Dr. Sengupta, Dr. Sampika Chatterjee and Dr. Shetty as our speakers. So we will be just starting our presentation right now, and Dr. Sengupta will be taking the first slot, then Dr. Chatterjee, and then it will be followed by Dr. Shetty. So thanks, and Dr. I will just request Dr. Sengupta to start his presentation, then we will be coming to the other presentations.
Respected Chief Medical Director, my senior colleagues and my fellow sisters, as I have already told that we are celebrating the Breastfeeding Week, and the slogan is exclusive breastfeeding for first 6 months. We should introduce nutritionally adequate and safe complementary foods after the infant reaches 6 months of age. So nothing is required actually before 6 months. And we can, after introduction of the complementary feed, we can still continue breastfeeding up to 2 years or beyond. What is actually exclusive breastfeeding? The definition is give an infant only breast milk with the exception of drops or syrups consisting of vitamins, mineral supplements or drugs. No food or drink other than breast milk, not even water. So that is the definition of breastfeeding, exclusive breastfeeding. What are the benefits of such exclusive breastfeeding? It is a complete food for the first 6 months, perfect nutrition for the baby, and numerous studies have shown that child who are exclusively breastfed is having higher IQs, and breastfeeding develop good emotional bonding between mother and the child. It prevents infection, prevents chronic diseases because it gives lot of immunity, and it is easily digested. So these are the benefits. And benefits to the mother: reduces the post-delivery bleeding and anemia, helps delay next pregnancy, protective effect against breast and ovarian cancer, helps to lose weight, emotional bonding, needs no preparation. There are many benefits to the society as well. It reduces the absenteeism of mothers from work as they are less prone to disease. It is much more economical. It enhances the bonding between the mother and child, and eventually the family is benefited and the society is benefited. Successful breastfeeding up to first 6 months of age, you can see that various developmental milestones. So up to 6 months, exclusive breastfeeding should be continued. What are the major hurdles? Dr. Somapika will tell. Lack of family support, lack of support by health professionals, commercial influence, feeling of not enough milk among women. Important do's: initiate breastfeeding as early as possible within 1 hour of birth. Do not give the baby any pre-lactal feeds. No bottles, artificial teats or pacifier. Breastfeeding on demand at least 8 to 10 times in a day and at night. Build mothers' confidence to sustain good milk supply and alleviate feeling of not enough milk. Breastfeeding should be initiated within 1 hour of birth. That is the golden period. If there is delay, then chance of failure is there. And if the mother has undergone cesarean section, then breastfeeding should be tried within 4 to 6 hours. So the basic idea is as early as possible breastfeeding should be started. What are the harm by pre-lactal feeds? We do not recommend any pre-lactal feeds because it replaces colostrum, and you know that colostrum gives lot of immunity. It is rich in antibody. Pre-lactal feeds reduces baby's desire for breastfeeding. It has greater risk of infection, risk of intolerance and allergy. So we don't recommend any pre-lactal feeds. No bottles, artificial teats or pacifiers for breastfeeding infants because it leads to nipple confusion. What are the basic ideas of successful breastfeeding on demand? 8 to 10 times or more in 24 hours. Breastfeeding should also be continued during night time. No restrictions on length of breastfeeds. No restriction on frequency of breastfeeds. In this slide, there are two important things. Oxytocin, oxytocin makes the muscles to contract, leads to the let down of milk, and prolactin helps for secretion of the milk. So these two are important, oxytocin and prolactin. These are the signs of correct attachment, because the child actually should suck from the entire areola, not only from the nipple. The mouth should be wide open, lower lip is turned outside, chin touching the breast, then black part of the breast not visible below the lower lip. Large black portion of the breast and nipple including milk collecting ducts are inside baby's mouth. Tongue under the teeth. So these are the correct signs of correct attachment. That means the baby is sucking correctly. This is incorrect attachment. You can see that the baby is only sucking from the nipple mouth is not wide open, chin is away from the breast, baby is sucking only the nipple. Most black portion of the breast is outside the baby's mouth, tongue away from the teeth. So this is incorrect attachment. This is not recommended. Causes of incorrect attachment: use of feeding bottles leads to nipple confusion, inexperienced mother, functional difficulty with the mother or the baby, lack of skill support. So here lies the role of the healthcare workers, sisters, ayahs, paramedical staff. They should teach, preferably during the antenatal period, regarding the correct way of breastfeeding, so that mother can learn. Successful breastfeeding builds mother's confidence during the prenatal period, during antenatal period, during postnatal period. I have already told that the health education of the mother and the family is very important for successful breastfeeding. These are the role of various hormones. I have already told that prolactin and oxytocin, both these hormones are important for initiation and continuation of the breastfeeding. Whenever the baby sucks the breast, then sensory impulses from the nipple goes to the brain, and as a result prolactin in blood is secreted, and this prolactin is secreted more at night, and it is also helps to secrete milk from the breast, and it also suppresses ovulation, so it acts as a contraceptive. Oxytocin reflects baby when sucks, sensory impulses goes to the brain, then oxytocin comes in the blood, and as a result of the oxytocin, milk actually flow, and also it helps contraction of the uterus. So it helps in involution of the uterus, early involution of uterus. Mothers, if mother is confident, think lovingly of the baby, sound of the baby, sight of the baby. These all helps in successful breastfeeding. And pain, worry, anxiety, stress, doubt, these are all actually hindrances for successful breastfeeding. The feeling of not enough milk, not true, just a perception. Mothers should be told that self-confidence is must. Ensure frequent suckling, ensure effective suckling. Conclusion: exclusive breastfeeding for first 6 months being successful. Initiate breastfeeding as early as possible within 1 hour of birth. Do not give the baby any pre-lactal feed. No bottles, artificial teats or pacifier. Breastfeeding on demand at least 8 to 10 times in a day, and at night a breastfeed in a correct position. Build mother's confidence to sustain good milk supply and alleviate feeling of not enough milk. This is the new slogan by WHO, that it is mom-made, not man-made. Definitely it is man-made, but properly told it is mom-made. It is very important for the baby, lifeline for the baby. These are the 10 steps of successful breastfeeding. I think some of the slide you have these steps, so I am not repeating. This we are going to implement in our hospital, so that our hospital becomes a baby-friendly initiative hospital. So these are the 10 steps which Dr. Somapika will tell elaborately. Thank you. Next speaker is Dr. Somapika.